Hi Jamie, how are you today?
Good, how are you?
Fine, thank you. So tell me a little bit about yourself, like what area or areas of nursing are you interested in and why?
Well, I have been a prison nurse for the past 6 years, so I'm interested in staying in the prison nursing field. I'm also interested in the emergency department. I've done some clinicals in there, and it actually interests me more than I thought that it would. And my main goal has always been to work in labor and delivery, nursery, postpartum care, one of those areas. So eventually I would like to get to there.
Tell me about your clinical experiences. Which rotations did you enjoy the most and why?
The area I enjoyed the most was pediatrics, just because that's more towards the area that I eventually want to get to. I've also enjoyed being in the emergency room. There's a array of things that come in that you never know what's going to hit you next. So that's exciting in a fast-paced world altogether.
What is the biggest mistake you ever made and how is the problem resolved?
The biggest mistake I ever made was waiting so long to go back to school. I had every intention from the day I graduated with my LPN to go back immediately the semester following and get my RN. Financial didn't fall into place, different things didn't fall into place. I always had some excuse for why I couldn't do it right then, and finally I was like, I have got to do it now or I'm never going to do it. So finally, a girl who I work with actually took the LPN to RN online program through AC, and that's how I found out about it. So I went through the online program and got in, and here I am.
Tell me about yourself. What do you see as your strengths and why?
My strengths, I would have to say, are I'm very organized. I have to have things put together in a certain way. Makes my brain work better, I suppose. I tend to be on time, actually early for a lot of things. I like to make sure that I can get there and have everything in line to get my work done for the day or whatever I am doing.
How about your weaknesses and why?
My weaknesses, I would have to say, my knowledge of medications, I think, would be one of my weaknesses. I need to amp those up a little bit. Working in the prison for so long, there's only certain things that we use, so I think those have kind of fell to the back of my mind. I need to amp those up a little bit, and I've been working on those through school. I have learned quite a few new medications and their side effects and effects on patients. I also would probably have to say that one of my weaknesses is prioritizing. I need to work on that, and I have been working on that, and have been working on that with my preceptors to help me learn which patients would be priority so that I can get a good mindset on that.
Tell me about a staff nurse who most impressed you and why.
The staff nurse I would say that most impressed me would be one that I have worked with in the past. She no longer works with us now. She started off as an LPN at the prison, and she went through and got her bachelor's and became an RN. She worked at the prison for probably about 2 years as an RN, and about a year ago, she just moved on to a new position. So I think I would have to say she's impressed me. One, because she was able to go back being a mother and a wife, and she was a student nurse, and she went back, she graduated, she got her bachelor's, she passed the NCLEX, and then she was a nurse at the prison for a while, and she's impressed me that she actually moved to another position, because quite a few of our nurses, once they get in there and they stay for the long haul.
How would your most recent nursing instructor describe your performance in the clinical setting?
I would have to say my most recent instructor would probably say that I did have some areas that I need to improve on, and I am working on those with my preceptor at this time. Improving on time management, prioritization, my medications, my skills. Working in the prison, I didn't have very much experience with too many skills, so I've had to really work on those in the clinical, and even being in the ER for the clinical rotation, there's some days you have really busy days and you have all kinds of stuff come in that you get to do, and then there's some days that it can be busy, but seems like the same things that you keep getting patients in for, so I've been working on those as well.
Tell me about your most challenging clinical assignment and what you learned from it.
My most challenging, again, would be in the ER. There was one night we had a gentleman come in. The family believed that he was filling up with too much fluid. We couldn't get an IV on him. The doctor even tried getting an IV through ultrasound. They ended up having to put a central line in. Going through the motions, having to put him on the BiPAP machine because his O2 sats were running in the 70s to 80%. It was very trying to know exactly what he needed and get things done quickly and in a timely manner to make sure that he was going to be okay to the best of our ability.
What skills do you feel you have gained from your past work experience that may help you in this position?
Skills that I've done in the past would be the medication administration. I think I have that one pretty much down to a T. Also, IV placement and phlebotomy. I've done a lot of that at the prison, so I have a pretty good handle on being able to find the right vein and get the IV in or draw the blood pretty good. My assessment, I think I do pretty well with my assessments. Working at the prison, they come up and you have 30 seconds to take a look at them and see if you can figure out what's going on quickly and if we need to get them out, or if they can stay at the prison and get some IVs and be okay.
Tell me a little bit about yourself. How would others describe you?
I think others would describe me as organized. They actually pickle me at work for all of my folders. I would have to say that I'm a caring nurse. Most people see that in me. I care about my patients. I want to make sure that they're taken very well care of and best that I can. I would also say that people see me as compassionate for my work. And I'm also a very good team player. I work well with others and get the job done.
What are your future career plans? Where do you expect to see yourself in the next 2 to 3 years or in 5 years?
In the next 2 to 3 years, I see myself as going back for my bachelor's. Hopefully working still at the prison, possibly, maybe in the ER, or eventually up labor and delivery, nursery, somewhere up there. In the next 5 years, I plan to have my bachelor's, and my major plan is to go back to school for my midwife. So hopefully in the next 5 years, I will be pursuing that.
We do not have any openings at the present time in the areas in which you have indicated an interest. Would you be willing to accept a position in another area? And if so, what other areas interest you?
I would definitely would be willing to accept a position somewhere else. I'm always open to broaden my perspective on nursing and broaden my skills. Med-surg is very interesting, so a position in med-surg I would be willing to take. Pediatrics, oncology. Pretty much I would be willing to try anything and just see how well I did with it.
Tell me about a time when you had to establish priorities during one of your clinical experiences.
Establishing priorities during one of my clinical experiences, there was a day in pediatrics. We actually had 3 patients, I believe it was, 2 of which were babies. So we had certain times that we knew they were going to be fed, and we had certain times we knew that the other patients were going to need medicines or that they were going to need medicines. So we had to, the nurse and I sat down and we decided on which thing needed done first, second, third, so that we knew that each patient got their medication, each baby was fed. We had 2 children that had an appendectomy that needed walked, so we had to plan that into our day and put it into, a little bit lower priority because walking wasn't the major priority. In the morning, it was just we wanted to make sure that they could be able to get up and walk around so that we could get them home.
Tell me about a time when you went out of your way to assist a family or patient even though you really did not have the time.
A day that I assisted a family or patient, I again would probably have to say up in the pediatrics. Again, we had 3-4 patients that day. The one baby was a little cranky. He was crying. He was tired of laying in the crib. So the RN that I was with that day said, why don't you go in and hold him for a little while? I know we have a lot of work that we need to get done, but if he continues to cry, we're not going to get anything else done. So go in and hold him for a little bit, play with him. We'll get him calmed down, and I'll work on this, and this while you do that. And then when you get him calmed down, then I'll fill you in and we'll continue about our day.
Thank you for coming in for your interview today. We'll be in touch.
Thank you very much.